Alzheimer's is the sixth leading cause of death for all Americans, and African Americans are disproportionately affected.
In this week's In Black and White, Fox 8's Jordan Brown shows us how one research center in Winston-Salem is trying to figure out why that is and how they can lower those numbers.
Alzheimer's disease affects African Americans twice as much as our white counterparts.
This is the data driving the work of the Maya Angelou Center for Health Equity in Winston-Salem.
We are focused on the genetics of Alzheimer's disease, specifically in African American communities.
Through research studies, staff at the Maya Center are working to uncover the why behind the higher risks for Alzheimer's disease in African Americans and why they're less likely to be diagnosed compared to white patients.
If you don't understand about why we are at a higher risk, then it'll be less likely that we'll be able to both identify it, because we sometimes don't know the symptoms, but also don't know about some of the things that we face medically that put us at higher risk.
Some of the reasons for lack of information is caused by several factors like healthcare inequities in minority communities and not knowing the symptoms.
Some of the signs and symptoms specifically of Alzheimer's disease may be memory, which when a person gets older, sometimes we accept that out of hand, not recognizing that memory loss in and of itself is not a common symptom of getting older. Slowing down of our memory and it taking longer to recall something is a part of normal aging, but complete memory loss is not.
Getting out into minority communities, educating the people there, and encouraging them to participate in research studies is part of the Maya Center's process.
We're actually doing some work now as well. We're looking at the genetics of Alzheimer's in African Americans. Yeah, we think that there may be some different reasons why we develop it more frequently.
If we have research occurring, but only specific groups are involved in that research, then we really don't know how medications, treatments are going to work in other populations. So it is important that there is a representative, wide and diverse group that participates in research.
But the research process is a marathon, not a sprint. The newly FDA-approved drug Leqembi is a direct result of years of research.
Prior to these recent medications, there really hadn't been much progress in medications for Alzheimer's in close to 20 years.
Leqembi has been proven to slow the progression of the disease in people in the early stages. Although it's a major step in the right direction, this drug is not a cure.
This is part of the reason to be part of the research that's going on. For the Leqembi trial, African Americans made up only 3% of the participants in that trial.
That's why the Maya Center emphasizes research in communities of color, hoping to get more people in those communities involved in the long but essential process toward a more permanent solution.
I think it's important that when we are working in our communities that they recognize that we are making progress.
In Winston-Salem, Jordan Brown, Fox 8 News.
For more information on the Maya Angelou Center and how to participate in research studies, head to our website, myfox8.com.